Hi, my name is Moyo.
Hi, my name is Ron.
Hi, my name is Tony.
Hi, I'm Essie.
Jane was recently in a car accident, a fender bender. In the weeks after the accident, Jane began feeling pain in her neck and her back. The pain was unbearable, so Jane decided to go see her physician to figure out what was going on. Upon seeing the physician, he ran a few tests, did a couple x-rays, and ultimately told Jane she had a deviated disc in her neck. He offered Jane two options: pharmaceutical drugs or surgery. Jane jumped at the idea of being able to take a prescription drug for pain versus having to undergo extensive surgery. Jane was elated when she felt no more pain after taking her pharmaceutical drug. After some time, Jane realized that she could not function without taking this drug. Jane also realized that throughout time, the dosage wasn't enough to alleviate the pain and she needed something stronger. The problem is, pharmaceutical drugs are harmful. In the Journal of Law and Medicine, 4th volume, Donald Light writes, over the past 35 years, patients suffer from side effects of prescription drugs with few offsetting benefits. One of the ways prescription drugs are harmful is they harm your internal organs. Ingesting prescription drugs, the powerful drug then goes into your stomach. These drugs are strong enough to eat the linings of your esophagus and often cause ulcerative colitis and gastrointestinal problems. Also, kidney failure is a common symptom of taking too many prescription drugs. Throughout time, your kidneys are not able to filter through the drugs, and oftentimes these drugs are left sitting in your kidneys, causing your kidneys to break down. Furthermore, these prescription drugs put band-aids on the problems and are not treating the source of the problem. Though the pain may be gone, what's causing the pain is still there, and it creates a worse problem over time. Prescription drugs also create more problems. Yes, they may fix your headache, they may fix your backache, but it's also giving you kidney failure, hypertension, and a number of other common ailments and diseases. Between 2016 and 2017, 270,000 emergency room visits resulted from opioid use. The cause of the problem? Doctors are paid by pharmaceutical companies. Ebenezer Kruwa writes, reducing avoidable medication consumption of quality medicine is expected to improve health, yet the benefits are lower and the risks are magnified. Most small doctors' practices are sponsored by pharmaceutical companies. These companies push medications for these doctors to give to their patients. Oftentimes, these drugs are experimental and they're just hitting the market. They're blind to the side effects, the pharmaceutical companies as well as the doctors, and it leaves the patient with a long list of problems that no one expected. Furthermore, doctors do not inform patients of the side effects. Though there may be side effects for these drugs, in order to keep pushing these drugs, doctors refrain from letting these patients know about the harmful side effects and the problems they cause. There are many solutions to the problem. The first solution is prescribing the lowest effective dose. This was stated by W.B. Sanders in the opioid epidemic. Prescribing the lowest effective dose allows patients to be able to treat whatever ailment or disease that they have without harming them any further. Furthermore, a second solution is encouraging your local legislation to push harder regulations for these drug companies and big pharmaceutical companies. Because America is a capitalist country, they thrive on big business, and pharmaceuticals is big business. By pushing legislation to regulate these drugs, it'll help cut out the many epidemics and many problems these drugs are causing. Furthermore, it is the job of these companies to produce non-addictive medications. That is their priority, stated by the National Institute on Abuse. In conclusions, pharmaceuticals are overprescribed and create harmful effects on the body. In recent years, the misuse is affecting adolescents and young adults in the ages of 12 and 17. I encourage all of you to educate yourselves on the harmful effects of these pharmaceutical drugs. I encourage you to push your legislators in local communities to regulate the pharmaceutical companies, and I encourage you to lead healthier lifestyles and create better eating habits and check alternative views before you go to pharmaceuticals. Thank you.
You know,